Joining me now is Mariana and Dr. Joseph Hewitt, who's an interventional radiologist from Pacific Interventionalists in Newport Beach, California. So I want to welcome you both to the show today.
Thank you.
And everyone needs to know varicose veins can happen to anyone. Literally, those superficial veins in your leg, the valves become weakened, pressure builds up, blood pools and collects, and you get that bulging of the veins. And let's talk briefly about who is at risk.
Well, Travis, everybody's at risk, both men and women. Women more so than men. Women who've had children. Anybody who has a job where they're standing on their feet or sitting for a long period of time. People who are overweight. And most importantly, people who have a family member, a mother or a father who've had varicose veins, that predisposes them to getting varicose veins.
And Mariana had the VenaCure procedure done a few days ago. Tell us how that works.
Well, the VenaCure EVLT procedure uses this laser fiber. The laser fiber is new and unique because it has a gold tip. And this gold tip, you can see the laser on the end of it. It's very simple. We take this fiber and we feed it into the sheath slowly. As we're feeding it in, it enters the vein. Once it's in the vein, we just turn it on. It heats the vein up and it causes it to close. What's really fantastic about this procedure is that gold sheath significantly decreases the amount of pain and bruising with the procedure.
And how many days out are you from the procedure?
3.
3 days. Everyone want to see the difference? All right, so I'm going to show everyone a picture of your legs before and have you stand up. This is a remarkable result. I see in 3 days, if I'm looking at your legs, I'm shocked. Of course, there's still a little bruising, but I'd be shocked to know you even had varicose veins.
Yeah, Marianne is a very good example of what we do. She had a primary varicose vein down the back of her leg that we treated, and then there was a branch that came around the front. And we used the VenaCure EVLT to treat the varicose vein in the back. And then as you saw in the video, I just took a small hook and I took that branch out from here, and she looks great. This is a fantastic result for her. There's a little bit of bruising, but otherwise she looks fantastic.
Are you happy?
So happy.
There are things that people can do, right?
Absolutely.
To help prevent these. Compression stockings, keeping the leg elevated. If you do have a job where you're standing all day long, you've got to take some breaks, do you not?
Absolutely. I tell everyone to be active and proactive. Active, get up, walk around. Lose some weight, exercise. Be proactive, wear compression stockings. But also, if you see a varicose vein, even if it's a small spider vein, go and see a vein specialist and make sure that there's nothing more significant wrong with your legs that can be treated early, taken care of, and prevent more serious consequences from happening later on.
And I want to show people a few more results. These have progressed even further than Mariana's, and you still get an amazing result. So this is really an amazing procedure, and you look great. Thank you for being on with us today. We appreciate it. Thank you so much for sharing with us.
Absolutely.